Good afternoon and welcome to today's session on common skin and hair loss disorders in people of color. I'm Tamara Brock and I am a Partnership Development Manager with Black Health Matters. The Black hair care market continues to grow every year and is valued at $2.5 billion. Black women in particular are prone to a type of hair loss called traction alopecia, which is caused by heat, chemicals, and tight styles that pull at the hair root, including some braids, some of the dreadlock styles that we see, extensions, and of course, wigs. Do you know what the warning signs are? Is your scalp suddenly more visible than ever before? Dr. Angela Keloidalis completed her undergraduate work at Princeton University and obtained her master's in public health at Yale University. She went on to get her medical degree from Case Western Reserve Medical School in Cleveland. She also completed her dermatology residency at the Cleveland Clinic. As a staff dermatologist at the Cleveland Clinic, she established the Multicultural Skin and Hair Center, where she treats skin conditions that disproportionately affect people of color. Dr. Keloidalis also founded Cosmopolitan Dermatology in Cleveland, where she specializes in hair loss and skin for people of color. Welcome, Dr. Keloidalis.
Thank you very much. I'm excited to be here. And I am just getting ready to share this screen here. I am not in control of my slides here. Okay. All right, there we go. Share screen. All right. All right, very good. Sorry for the delay. We're going to get started. So this afternoon, we're talking about common skin and hair disorders and skin of color. I hope you get a lot out of this talk. We're going to focus on the common disorders that we see in people of color. We're going to start with basic skin and hair differences, which I think is very important because we don't tend to know the main differences that informs the kind of skin conditions that we see. We're going to talk about common skin disorders and common hair disorders. So, a basic question is, do we know what makes some of us darker skin versus some of us lighter skin, right? And was that important? Why are some people darker versus lighter? Well, it turns out that skin color is just an adaptation. It's not, it's just a way for us to handle the sun on this earth. And in fact, everyone has color in their skin. It's not just skin of color. When we say skin of color, is a misnomer. Every human being on this earth has to have color in their skin in order to be able to handle the harmful rays of the sun. So if you're darker skin, it just means you have more of an ability to handle the sun, meaning that you can block the sun's harmful rays much, much better than someone who is lighter skin. So our lighter skin friends just don't have as much ability to block the sun. So they have to be more cautious in the sun. So in dermatology, this is such an important concept that we divide up the skin into different types. We call them the Fitzpatrick types based on your ability to handle the sun. So if you are a Fitzpatrick type 1, you are very fair skinned You're usually freckled, red-haired, and you always burn in the sun. You do not have protection, much protection in terms of handling the sun. If you're type 2, someone who's usually blonde hair, blue-eyed, you're also very sensitive to the sun, but you do not, you don't always burn. You do have a small ability to tan. Type 3 skin, someone who's a, brown skin, Italian, can tan somewhat, but still can burn in the sun. So they have to be extra cautious. The type 4 through 6 skin here, this is a group that is very able to handle being in the sun because their skin is easily adapts to the sun, to getting dark, so they get protection from the sun. So it turns out the vast majority of the world's population is skin type 4 to 6, that's skin of color. The vast majority of the world's population is skin of color. So, when you look at the population of the world at large, darker skinned people are the majority, okay? And that is for a simple reason that the vast majority of the world's population is centered around the equator. The equator, which is the middle, I hope people can see my mouse, is where the most sun exposure is. And it makes sense that if you live close to where there's most sun exposure, your skin will be darker. You have to have the dark skin to protect you from that severe, harsh sun's X-ray rays in that area. And if you look at this, gradation of color, the further away you get away from the equator, the lighter skinned you are. So, when you look at the world's population, it's a beautiful microcosm of many different hues, from someone who is very dark, meaning they live close to the equator, and then brown, a little further from the equator, and then very fair skin, the furthest away from the equator. So the human race is just a beautiful, sort of rainbow of different, hues of brown and light skin. And it's just about an adaptation. How do you handle the sun? So we're all one race. The idea of being a black race and a white race doesn't make any sense in science, because in order to be two different races, you have to be completely different. And as human beings, skin color does not make us completely different. It's not enough of a difference to make us different races. We are all one race with very different, beautiful colors. So we go through all of this because this informs the type of skin conditions I see in skin of color. The excess color, the dark color that we see in skin of color, is important when you're looking at skin conditions that affect us. So darker skin patients, black skin patients, just are able to churn out and quickly churn out melanin. Melanin is like the ink in our skin that kind of occurs when we have sun exposure. So we all have this special cell in our skin called melanocytes. Melanocytes basically make melanin, the color that you see. And as soon as it sees the sun, it churns out melanin. Well, it turns out black patients, or if you're darker skin, your melanocytes make a lot of melanin, and they make it fast. That's why you don't burn in the sun. If you're lighter skin, you still have to make melanin. Otherwise, you can't survive, on Earth. You have to make melanin. There is not a single person on the face of the earth that does not make melanin. You would die without, melanin. All right. So in some ways, we're all people of color, because you have to have color to survive on Earth. Darker skinned people just have more of it because they originated in areas where sun exposure was very, very severe. So black patients make a lot more melanin. They make it strongly, they make it quickly compared to our white friends. So again, the differences are spelled out here. We have increased melanization in dark skin. What does that lead to? Increased sun protection. It also leads to reduced skin cancer. Why is that? Because the sun's rays causes mutations in the skin that lead to skin cancer. So if you block the sun, you automatically reduce your risk of skin cancer. This also reduces the risk of wrinkling. Now, I know, ladies, we care about wrinkles. Why? Because the sun is what breaks down the collagen in your skin that causes wrinkles. And therefore, if you protect yourself from the sun, you wrinkle less. And people that are darker skin have this natural sunblock called melanin that blocks the sun from doing, the damage of even wrinkling. So darker skin people increase sun protection that leads to reduced skin cancer, reduced wrinkling, but the downside is we get increased pigmentary disorders. What is that? It means we get discoloration. When we get a rash, it leaves a mark. When we cut ourselves, it leaves a dark spot. The melanin not only reacts to the sun, it reacts to injury, it reacts to rashes. And so we get a lot more blotchy skin conditions compared to our Caucasian friends who have less melanization. They have melanin, but they don't have as much. Okay, remember, everyone needs melanin to survive. And so they have increased skin cancer, increased wrinkling, but they do not have the problems of the blotchy skin that we as people of color do. So increased melanin leads to really good UV protection. In fact, darker skin people tend to have 3 times the UVB protection as our lighter skin friends. The downside to the melanocytes being really easily spilling the melanin and causing, and protecting us from the sun is it also causes some injury. When you have, any kind of injury or any kind of rash, these cells spill more of that color, that melanin, and we get what we call pigmentary disorders or blotchy skin. When you go to, a dermatologist, you want to do laser, they have to be extra cautious because as a person of color, laser is considered injury to the skin and it can cause more blotchy skin. So we're going to dive right into the, skin pigmentation disorders we see in dermatology. This is someone who is displaying melasma. Melasma is a condition where the skin turns darker, it's exacerbated by the sun. And then another common pigmentary disorder in our skin type is post-inflammatory hyperpigmentation. Now that is a condition where, you get acne, it leaves a mark. You get eczema, it leaves a mark. Very common in our skin type. And that's exactly what this slide, summarizes. Darkening after an injury or inflammation is what we call post-inflammatory hyperpigmentation. And a lot of those of us who have had acne, we know when it heals, it leaves a spot. When we get eczema, it leaves the discoloration. So this is actually a patient from my practice who you can see has acne, but has the discoloration as well. Now, if you go to somebody who's not used to treating skin of color, they'll treat the acne and forget about the dark spots, but you have to treat the dark spots. And after we use a tone correction cream, you can see that afterwards her skin was completely clear. Now, if you just treat the acne and you leave the marks, it doesn't look good. This is another patient. She had her acne treated by another provider and it still left marks, so she was unhappy. She came in, we used a tone correction cream, and I'll talk about what that is later, and it cleared up all the discoloration. And then, a lot of us have unwanted hair, what we call hirsutism, where we get a lot of unwanted hairs in the chin area, and it leaves this dark, blotchy, uneven skin that none of us likes, right? If you treat the area with laser hair removal to get rid of the hairs, but the marks are still there. So here we did laser and used a tone correction cream to help her get close to her normal color. Another coloration issue that we have, maturational hyperpigmentation. If you'd like, look around you, see that a lot of people, if you look at the sides of their face, is darker. Okay, and then it sometimes goes with the neck also getting really dark. This is very common in our skin type, and it's associated with weight gain and diabetes. Very common and something that I see in my practice a lot. Again, all of these are treated similarly. Patient with melasma, we use a tone correcting cream, combination of vitamin C, kojic acid, hydroquinone, and it evened out her skin nicely. So what am I talking about tone correction? Tone correction creams are skin brighteners. You've heard of vitamin C, kojic acid, arbutin. Those are all skin brighteners. We combine it with hydroquinone, what we know we consider a bleach, but we're not bleaching your skin to a different color. We're just removing the excess color that comes with the melanocytes kind of, overreacting to the injury. So we try to even out your skin tone and blend it. We also use some chemical peels and microneedling and laser therapies, but you have to tread very cautiously in skin of color because as you know, that can also create discoloration. This is more patients that we treated with a tone correcting cream. A lot of us, as we get older, our lips get darker and our gums also get darker. This is normal in skin of color. I get, consultations for patients, they tell me, oh, my gums are getting dark. Well, that's, that can happen in our skin type. 80% of Blacks, us over the age of 60, have some kind of gum discolor darkening and lip darkening. Our nails, sometimes you can get dark streaks in the nails, another common condition that we see. 50% of us over 50 years of age have at least one nail involvement. With this particular condition, you gotta be careful because melanoma, the deadliest skin cancer in human beings, can present as, it can present as long dark streaks in our nails. So we gotta rule that out. That is very important. And although melanoma does not affect African Americans nearly to the extent it affects other groups, we die of it more often. So we have to make sure we're always ruling that out. So we're gonna move on quickly to the scarring disorders. So we've talked about the melanocytes, being very finicky and just spilling that melanin and causing some hyper discoloration on our skin. Well, it turns out the cells that make collagen that help with the wound healing process are also very reactive in our skin type. They're called fibroblasts. They make the collagen and elastin and all the proteins in our skin that keep our skin thick, and it keeps our skin, they heals our skin when we get injuries. Well, in darker skin patients, these fibroblasts, these cells, they're overactive. So this leads to more scarring when you injure yourself. Keloids, I'm sure a lot of you have heard of keloids, the thick scar that you get when you pierce your ear, or some of us have it, on our chests from acne or other injuries. Well, that's an excessive healing process because we have these cells that overreact in our skin type. When we have, surgery, we get thick scars. On a more positive note, because our cells make more collagen, again, our skin is more preserved, our skin is thicker, it doesn't age as quickly, okay? Compared to our Caucasian friends who's, they have the exact opposite. They don't keloid as much as we do. So this is your typical keloid. Keloid is just a thick scar, and it comes from injury. When you injure yourself, your fibroblasts go crazy, they heal you, but instead of stopping the healing process, they go on and create more collagen than is needed. You get that lump on your ear. Our men, our Black men, get this thick keloidal plaques here because they get hair follicle bumps. When it starts to heal, it overheals and it gets this thickened scar called a keloid, okay? Keloids are considered tumors, actually. A tumor is just an overgrowth of tissue, and it's very common in us people of color. It can occur from surgery. So some of us who have, breast surgery or, you get a C-section, you can get keloids in that area, and it's because your skin overheals. Before you have any surgery, as a person of color, you gotta know whether you keloid or not, so they can take appropriate action to help get rid of the keloid after the surgery. Currently, keloids are tough to treat, but we inject it with steroids, and then I cut a lot of them out and followed up with steroid injections. So this is an actual patient of mine. She had a large keloid on her ear. No one wants this. This came from a piercing, and she came in and we just cut it off. We cut it off. I followed it up with steroid injections, and she did beautifully. We're going to move on from the skin and talk about hair. Hair is a huge topic. I'm going to try to give you the gist, and then hopefully we can have questions at the end. So what about hair? Have you ever asked yourself, why is it that I have this curly hair that is hard to manage? Why is my hair not flowing down beautifully like, my Caucasian friends? Why is it so hard to get a comb through my hair? What's all the madness about, right? Well, there is a reason for everything, right? I just say nature is so beautiful. If you originally come from, close to the equator, you also not only have to have dark skin, your hair has to protect you from your scalp. It has to protect the sun from reaching your scalp skin. The best way to do that is to have curly hair. Your curly hair blocks the UV from entering your scalp. This is also why most people of color don't have naturally light colored hair, because the black color blocks the sun. The black color of your hair acts like a sunscreen and it shields your scalp from the sun. So the curlier your hair and the more the hair stands up instead of fall down and flow, the better it is for your survival in an area of the world where there's a lot of sun exposure. All right, so there's a method to God's madness, so to speak. The curly, thick, big hair protects you from the sun. It acts like a little hat, right? That protects you from the sun. So it has a function. It's nice to know that when you're pulling your hair and going through all that process and feeling like, it's a pain in the butt, right? Right now, there's such an embrace of our hair in its natural form. And I think it's a beautiful thing. We are learning about our own hair and appreciating and loving our hair. So it's good to know that there's a reason our hair was made that way. So this slide, informs us again, if you have straight, silky, long hair, the sun goes straight into your scalp and causes damage. If your hair is big and curly, the sun just scatters, the UV rays scatters. So it's much, much better if you are from, you're in an area of high sun exposure to have a thick, big afro hair compared to a smooth, silky hair. All right, so this is why the shape of our hair is also different. Our hair is very coily compared to straight Caucasian hair. Our hair just curls, it's like a little spring, and it just curls because remember that its function is not just beauty, it's meant to protect you and help you survive on, the conditions of the earth we find ourselves in. When you do a biopsy, if you look at Caucasian hair, it grows out straight, bone straight through the scalp. This is the skin, it goes straight out. If you look at our hair, it's curved underneath, and when it comes out, it curves right back into the skin. This is why we sometimes get, hair razor bumps in the beard and in the bumps in the back of our scalp, which I'll talk about later. What else is different about our hair? Why is it that you don't wash your hair every day like our Caucasian friends? Well, you don't need a degree to know that dries your hair out, right? You don't need a doctor to tell you, hey, you shouldn't wash your hair every day. You know that from experience that washing your hair every day is just not good for our type of hair because we don't make as much oil. We don't produce that oil that makes our hair greasy like our Caucasian friends. Our hair tends to be drier. All right, that's why we wash our hair less. We didn't need a medical degree to know that we shouldn't wash our hair every day. Our hair follicles also, they don't retain as much water. So when they did, they did experiments to see how much water our hair just absorbs, right? And you can see that African hair or curly hair absorbs far less water than Asian or Caucasian hair on this slide. This is another reason why our hair stays dry. And that's why we don't shampoo as much, because shampoos by definition are detergents that strip your hair of oils. And we already have an issue with dry, brittle hair. So a lot of times my patients come in and they tell me, oh, I saw a dermatologist for my dandruff. They told me to wash my hair every day, and so I left them. It's true. I mean, washing, that may be good advice for someone who's Caucasian, but for African-American or, coily hair, washing the hair every day will cause a lot of breakage. You have to be very cautious because, dry hair is an issue for us. So in summary, we have certain hair shaft differences. Our hair is curlier, is drier, it's more fragile. And so it has to inform, what we do with our hair. So let's talk about some hair problems we see in the clinic. Pseudofolliculitis Barbae. We talked about how our hair doesn't grow straight out. It curves right back into the skin when it grows. And when it does that, we get these hair follicle bumps. This is what we're calling pseudofolliculitis. We see it in a lot of Black men as well as women, because we tend to have hairs right here. And when it grows, it causes those, hair bumps that are a pain to deal with. This is why, is because our hair, pattern is different. This affects a lot of men, but women as well. And the treatment for it, I have a lot of men who come in and they're in the military or in the police force, and they're forced to shave. The shaving causes your hair to grow out again and form that bump. So I often have to write letters to patients for patients to excuse them from shaving, because shaving makes this worse. I use a lot of laser hair removal for this condition. It works beautifully. So another condition is called Acne Keloidalis nuchae. It's a thick, keloid bump on the back of the neck. We see it a lot in our Black men. And it's, again, the same condition where the hair follicle grows in and curls right back into the skin. And it causes this acute inflammation and thick scarring. Treatment is very difficult. And I often have to use topical steroids. I inject them. And then I often have to do surgery to cut that whole area out and then inject it with steroids. But it is something that we see more in our skin type because of the way our hair behaves. Now, we all know about traction alopecia, right? This is the thinning of the hair that we see on our edges, our temples. Is very common in our group because of what we do to our hair. It's, it's caused by excessive tension on these hairs, from braids, weaves, rubber bands, cornrows, and even relaxers. Now, I'm a Black woman. There isn't a hairstyle I haven't sported or I haven't worn. I've done the weaves, the braids, all of it. And this is one of the things that comes with it. Anything that tightly pulls on your hair, weaves or braids or wigs, they all can cause traction alopecia. And one of the wonderful things about our group, us as people of color, is just the diversity of, our hairs. Our hair is amazing. We can do so many things with it. It's something that I'm proud of. But we just have to know that, we need to modify certain ways we wear our hair so that it minimizes the damage. These are cornrows. These are, tight, single braids. It pulls your hair and give you traction alopecia. All right. But we treat traction alopecia. It can be, you just avoid the tight hairstyles. If there's inflammation, I give you steroid ointments. I do injections. I give you minoxidil. Treatment is possible. Okay. Another condition is something called central centrifugal cicatricial alopecia. It's a big name, but it's when we lose hair permanently at the top of our scalp and it spreads. This is the most common scarring hair loss in Black women. I have thousands of women with this condition, and it's devastating. And knowing about it is part of the cure, because if you know, you can get help early and stop this from being this severe. All right. Very, very common condition. And it tends to happen in middle-aged women, but I'm seeing it more and more in our younger patients as well. There's all this inflammation that occurs in the scalp, and it kills the hairs permanently. We don't know the cause, but we believe there is a genetic component. This is a 26-year-old patient I had, just 26, who had already started getting this. And this is where we biopsy to find out. Another young woman, not in her 40s, but in her 30s, who has this condition as well. So the treatment is you have to avoid the hairstyles that damage your hair. All right. I know that's hard. I had to go natural myself. I know it's a difficult process, but you got to think about it and see what is causing the damage and stop doing those things that cause the damage, right? Steroid injections, we do a lot of that. Topical steroids, we use anti-inflammatory medications like plaquenil, hydroxychloroquine. And then there's a new treatment called platelet-rich plasma. I don't know if a lot of you have heard about it, PRP. You come in, we draw your blood, we spin it in a machine called a centrifuge. And then we actually take your own body's natural growth factors and inject it into your scalp. And it really is helpful for this condition. It's not a cure. We do not have a cure. That's why prevention is everything. But this PRP procedure is very helpful. This is a patient we had who has this central cicatricial alopecia. And then when we got her treated, we got some improvement. Notice that she's not completely like cured, but we got some hairs back. We did a lot of scalp injections, topical steroids, minoxidil. We hit her hard with everything that we had. Another patient, you can see the loss is right here. This one, we were more successful. You see, she got a lot of her hair back. So some are more successful than others. This is another patient I recently saw. She's doing quite well. So in summary, you know, it's good to know that there's a reason you have curly hair. Our hair has a purpose, all right? And that makes it, you know, it helps you to accept it and not be so, I don't know, negative about how we speak about our hair and the curliness of it. It was there for sun protection. It's the reason that we survived as human beings, okay? But you know that it requires more moisture, all right? Because we don't retain as much moisture and our hair is not as oiled as our Caucasian friends. Avoid heat and chemicals that weaken the hair follicles. Seek treatment for hair loss early, because if you don't, some of it becomes permanent. And avoid tight styles that pull your hair. Again, early treatment is critical. I cannot overemphasize that. And with that, I will stop there and we can get some questions in. All right, so let's go ahead and look at some questions here. All right. So let's take some questions. So our first question is, excited about this particular webinar. Thank you for sharing in today's summit. Does hair thinning necessarily occur during a woman's menopause season of life? That's an excellent, excellent question. Hair thinning can. It doesn't happen for everyone, but it can occur during menopause. Why is that? Because menopause is a very hormonally challenged time in our lives as women. Our estrogen levels tank, they go down, and our testosterone levels, the main hormone that causes thinning is testosterone. And guess what stops testosterone from thinning our hair? Estrogen. Well, when you go through menopause, guess what? You lose a lot of estrogen. So a lot of people shed and their hair becomes thinner during menopause, but not everybody has that to the same degree. Some people have genetic thinning that causes them to thin more than others. But in general, that is a time where thinning does seem to be worse during menopause. And then another question, let me see if we can get more here. Is there anything that I can do to help prevent alopecia? Oh, there's plenty. There's plenty to be done. Alopecia, by the way, is not just one diagnosis. There are many, many different forms of alopecia, including, you know, the traction alopecia I showed you, the CCCA hair that we talked about. There are many different types. The key is if you're losing hair, go to see your dermatologist so they can diagnose the correct alopecia and treat you appropriately. I think we have time for maybe one or two more questions. What can I do to stop discoloration of natural gray, white hair, yellow? What can I do to stop discoloration of natural gray, white hair? So there's not much you can do. As we get older, we lose the melanin in our hair as well. And that's genetically controlled and everybody loses it to a different degree. So that is really not in your power to determine whether you gray sooner or not. Now, we do know that those who worry a lot, stress can make you gray overnight. You can lose hair from excessive stress. So keeping your emotional health well balanced is a small thing you can do, but in general, there's not much else you can do. And then one last question, what are the most common skin conditions in Black women? Oh, there's so many. There's so many. I try to go over the ones that have themes. I mean, every person who treats skin of color in this country knows that discoloration, hyperpigmentation is a big thing in our population. And as far as also the hair loss and the scarring. Those are the three themes that seems to be prevalent in our skin type: the discoloration, the excessive scarring, and then some issues with hair loss. So I think that is all we have time for. And let us look at what more we can do. All right. All right. Okay, and I think, all right, that's it. I think our session is over. I would have loved to stay and answer more questions, but if you have any further questions, would like to send me an email. I'm happy to share my email address. It's Angela, ANGELAKYEI @cosmodermatology.com. Happy to answer any questions you might have. And thank you for being a part of this session. I enjoyed it. Hope you learned something.